Welcome back, everyone, to Health and Retirement Golden Advice for Your Golden Years. I'm your host, Trey Basa, a licensed health insurance advisor with Market Medicare Advisors, and today I'm joined by our newest addition to the Market Medicare Advisors team, Drew Padgett. Drew, welcome in. Happy to have you, man.
Trey, thank you for bringing me in here today. All right, guys, I'm Drew with Market Medicare Advisors. I'm a insurance advisor here, and I really got into this space because I wanted to help people, and I'm pretty experienced with Medicare Advantage plans, so that's why Trey brought me in here today. I know everything with the dual, the LIS, and all the different co-pays and the navigations you have to use when going through an Advantage plan. I know all about the networks and everything like that, so I'm happy to be here.
To kick things off on today's episode is our first segment, In the Know. Market Medicare Advisors is dedicated to keeping you in the know with all things health and retirement. Our segment today is going to be all about Medicare Advantage plans. There's a lot to know about Medicare Advantage plans before signing up for them, Drew. Let's talk about a couple of those things. First and foremost, I think the biggest selling point on any Medicare Advantage plans, premiums.
Yes. Now, most Medicare Advantage plans have $0 premiums, and that's why you see on TV, free, 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 free. Well, they're not exactly free.
We should go to note that some Medicare Advantage plans in different areas, different states, different zip codes in those states, they may or may not have Medicare premiums associated with them. But that is the number one selling point with these Advantage plans, is that they're always advertising free, free, free. But like you said, that's not always the case. Where do some of these costs come into play on Medicare Advantage plans?
Yeah, so some of these different plans have different benefits, and the higher end benefits you get, you could pay a little premium for that plan. Now, if as a food card and you don't qualify for LIS or dual, you could pay a premium to get on that plan, but it's just different qualifications for different plans.
Right, and every single plan, all of those different types of plans, they will always have a network, some sort of network associated with them. More commonly known as HMOs, PPOs, those are the most popular kinds of networks. But HMO plans, they do really well in this one network, but they don't do any assistance outside of that network. PPOs, preferred provider organizations, on the other hand, they offer really good service in network and then some service out of network. Again, these are the catches with these Advantage plans. They're advertising free, free, free. But are you double checking your networks, your providers, any services that you get outside of your doctor's office, your hospital? Not to mention co-pays. Every time you get something done, you have to pay for it, right?
Yeah, whether that's lab work. Now, usually for your primary doctor, you're typically going to have a $0 copay, but that's not the case for all instances. But if you're going to go see a specialist, if you're going to go see a chiropractor, you're going to have copays for that. It's going to be pretty low copays normally, but you're still going to have a copay.
Right. Every single little service somebody gets on an Advantage plan. Preventative services, your primary care physician, $0. A specialist, ears, nose, throat doctor, $25, $35 every single visit. Physical therapy, 3 sessions a week for the next 8 to 10 weeks. You're paying per session. And that is the copay agreement that you sign up for with this quote unquote free Medicare Advantage plan. Now, it's not all dollar signs with these Advantage plans, right? They give you a little something to sign up with them.
Yeah, they give you a lot of good perks and benefits. Most offer a gym membership, so you can go to the gym for free, and then you get an OTC benefit, over the counter, to pay for your Band-Aids or your low, super generic drugs, everything like that.
Yep, the over the counter allowance, big selling point as well. But they often neglect it's a quarterly allowance on pretty much every single plan I've seen. A quarterly allowance, every 3 months you get $90, $50, whatever it might be. And then I don't know if you've seen this as well, but they also require you to use that allowance through their online pharmacy.
Yes.
So
and that allowance does not roll over either. On most plans, it does not roll over. So it's use it or lose it.
Golly, it's one catch after another. But they often include benefits for the Medicare Advantage user to take care of themselves. You mentioned the gym membership. Another one I think a lot of people are looking for, dental vision hearing. Built into these plans, no additional cost. They want you to take care of your teeth, your eyes, your ears, because and correct me if I'm wrong, but I think a lot of health problems come from your teeth, your eyes, your ears, not just heart or neurological stuff, but they're also addressing, the smaller things that people look for on these plans as well. What's another benefit? I feel like I'm missing a big one.
Yeah, well, Medicare Advantage comes in with their own built-in prescription drug plan as well. So,
of course,
it's one of the biggest ones on there, and that definitely helps out because you're paying for your prescription drugs, but you're not paying the premium for the plan.
Oh, so another free benefit added into that. Okay. No, yeah, all of these things, they're hunky-dory, absolutely awesome to have, but these Medicare Advantage plans are not set in stone. They change every year. The premiums that you could pay for the plan change. The co-payments for your doctors, for your labs, for your x-rays, hospital stays, they change every year. Benefits, they might add more onto co-payments, but also increase your benefits or reduce some benefits and lower your co-pays. And then what else did we talk about? Oh, and then prescription drug coverage. That changes every year in the Advantage plans as well. You do not have the same coverage year after year. That is why it is of utmost importance to sit down and review your Medicare Advantage plans every year. Drew, when can people sit down to talk to you about their Medicare Advantage plans?
Yeah, so the perfect time is AEP, otherwise known as Annual Enrollment Period. So annual enrollment period is October 15th through December 7th. And Medicare gets pretty hectic during AEP. That is the busiest time of the year, no doubt. And if you need to meet with someone during AEP, you got to schedule it a couple months beforehand. But if you're on an Advantage plan, you have to check in every single year because your plan will not be the same.
Now, unfortunately, we're going to see that come into play with Drew's story in the second segment, but wanted to make sure that you guys knew that you have to review your plan every year. It is not the same. And if you would like to have a greater conversation about your Medicare Advantage plans or just your Medicare plans in general, please feel free to give us a call at 833-MAG-REPORT. That's 833-624-7376. Or you can email us at mail@marketmedicareadvisors.com and connect with us today. Our next segment for the show is going to be the client case study, where we break down and explore client cases we're actively working on. Today, Drew actually brings in a story, a situation that he worked on just last year. He ran into Susan in the Kansas City area, running into a little bit of trouble with her Medicare Advantage plans. Why don't you tell us a little bit more?
Yeah, so I had a client, we can call her Susan, a 68-year-old retiree, and she had recently enrolled into a Medicare Advantage plan. And she chose that plan during the annual enrollment period. A few months in, she started getting some unexpected bills for routine lab work and a specialist visit. And the services she had weren't really, the numbers weren't adding up. She was getting billed out of network, which she did not know yet. And to make matters worse, her primary care doctor had left the plan network. So she was struggling to get answers from the insurance company customer service. She was calling in on the back of her card, checking with the reps, saying she could not get any answers.
And that doesn't help the situation either. Susan doesn't speak the same language as the insurance company. So we have the background. We understand what Susan's going through and how she's feeling. What exactly was the problem? How did you uncover that?
Yeah, so there were a couple different problems. The out-of-pocket expenses, they were stacking up, and she did not know what was going on. She got told one number during AEP, what it was going to be for those services, and she was getting billed another number. So that was a huge misunderstanding. And then her primary care doctor, he was once in network and now he left the network, so she thought she had to switch. She didn't know what was going on. And she was just unable to get clear guidance on what her plan actually covered. So those were some of the different issues. And the final issue was she was overwhelmed, and nobody wants to switch their insurance mid-year. Nobody wants to do that. It's pretty hectic, but it was barreling down, and she kind of needed to.
So Susan probably had the understanding I could only change my plan during AEP.
Mm-hmm.
It's March. I have to be on this plan for another 9 months. I have to rack up the rest of these bills. I have to go see my doctor out of network. Where does this all lead us to? What's the solution? How did you help Susan?
Yeah, so when she enrolled into that plan during AEP, I was not her agent. So when I found her in March, one of the first things we talked about was her primary doctor leaving network and her getting billed these out-of-pocket expenses. So I quickly identified that she has a special enrollment period because her primary doctor left the network. So another thing was her out-of-pocket expenses. The lab work she was getting done was out of network too, so she was getting billed out of network cost, which is extremely higher than a in-network cost. So we reviewed her plan, and it obviously was not the correct plan that she needed to be on. And since she had that special enrollment period, she was able to switch to another plan where her primary doctor was in network. Her lab services that she goes and uses are in network. So we got all the costs down, and we got her happy and switched in her prescription drugs at a lower cost. And the plan was much better, had better benefits, and it just supported her way better.
I'm gonna throw a curveball at you. What do you think went wrong with Susan's AEP?
So what went wrong is she did not have an agent. She called in to the insurance company and enrolled. And so by doing that, she just got mailed a bunch of different papers, not knowing what it all means. And
it sounds like AEP.
Yeah. And when she found me, she said it was a blessing in disguise.
Well, absolutely. Whenever we meet with people, we sit down and we learn about them. We ask them to bring in a list of doctors and prescriptions because guess what? Who you see for what matters on a Medicare Advantage plan. You have to make sure everybody's in network year after year. And if you don't, you could run into these problems like Susan. You get hit with these out-of-network bills, and all of a sudden, you're on the hook for that bill. That you already have the insurance. It was billed to whoever out of network already. You're not getting new insurance until next month. You are stuck with that. That is not avoidable. Had she sat down and met with anybody from Market Medicare Advisors, we would have done our due diligence, got to know Susan a little bit better, make sure that she was on the right plan. Heck, she switched in AEP, right? Maybe she switched off of something that was already working.
Yeah, she called in, so I believe she might have been with an agent before, but then when she called in, she loses that agent that helps and guides her. So,
and that's the unfortunate case with a lot of these big insurance companies. You have a call center number, and when you call in, you don't know who you're going to get. You don't know if you are going to be able to effectively communicate with them. Like I said, sometimes you speak a different language than the insurance company. But that is why it is important to sit down with an agent, have that face-to-face interaction, and get to know us so we can get to know you and help you better. At the end of the day, if you think you might be in a situation like Susan, or even if you want to prevent being in a situation like Susan, please reach out to us and schedule something for AEP coming up. You can always call or email us to have a greater conversation. You can email us at mail@marketmedicareadvisors.com, and we can always have a greater conversation there. Not to mention, you can always schedule a phone call with us and have a greater conversation. Just a quick complimentary consultation, just to see if we're going to be a right fit. Because, like you said, she had an agent. but couldn't get in touch with them, couldn't reconnect with them. And I think that's a huge problem.
Yes, definitely. Definitely a huge problem. Your agent's always got to be there for the client.
That brings us to our final segment for the show. That is our mailbag segment, where we take a question from viewers just like you and answer them right here on the show. Today's question comes from Carol in Lenexa, Kansas, asking, I see on TV commercials and I hear from folks about a food card with my Medicare Advantage plan. How do I get that benefit?
So the tricky thing is you only get that benefit if you are low income subsidy and LIS has 5 different levels, or you are 100% dual and you are just on that low income level. You don't actually get that if you're just on a normal MAPD. It's called a dual special needs Medicare Advantage prescription drug plan, not a regular Medicare Advantage prescription drug plan.
And I think that's one of the problems with the commercials that folks see on TV. They see all of these benefits flashing on the screen for free, for $0 a month. But there's a lot of ifs, ands, or buts with that. You have to meet some sort of standard, LIS. Like you said, there are 5 different levels, and not everybody's going to fit in any of those levels. Not to mention DSNP, dual special needs, or even CSNP, chronic special needs. Very, very particular plans for folks that have very particular needs.
Yeah, and most of the time for that dual special needs plan, you need to have Medicare and Medicaid. You need to have both of those. For low-income subsidy, there's 5 levels, and you don't need to have Medicaid, but you got to be low income.
All of these ifs, ands, and buts. And now our clients have to go out and research that. They have to understand that, or they could come in, talk to Drew,
and
talk
we
to
could
Trey.
get it right up on the computer, and we could let them know in 5 minutes whether or not they have it or not.
There are a lot of tools out there at our disposal, pretty easy, but it really comes down to taking the initiative and speaking with an agent today. That'll be it for today. Be sure to subscribe to stay tuned for more videos just like these for all your Medicare needs. Don't forget to like and share so you can help your friends and family by getting them the information they need to know about their Medicare premiums, policies, benefits, co-payments, all of that fun stuff. You can catch this show and our entire catalog of shows on our channel, youtube.com/@retirement-help, where we archive all our previously recorded and aired episodes with professionals from healthcare, financial, to estate, to tax sectors as well. All of us coming together in one place to talk about how we're actively working with clients today to prepare them to live their best lives in retirement. I've been your host, Trey Basa.
And I'm Drew Padgett.
Thank you so much for joining us here on Health and Retirement, the talk show of golden advice for your golden years. We'll see you next time.
Investment advisory services are duly offered through Foundations Investment Advisors LLC, an SEC-registered investment advisor, and Market Investment Group LLC, an SEC-registered investment advisor. The investment advisor representatives of Market are also affiliated with and registered through Foundations Investment Advisors LLC, and may provide services on behalf of both firms to client or prospective clients where properly licensed or exempt. This show is presented by Market Investment Group LLC, an SEC-registered investment advisor that only conducts business in jurisdictions where it is properly registered or is excluded or exempted from registration requirements. Registration as an investment advisor is not an endorsement of the firm by securities regulators and does not mean that the advisor has achieved a specific level of skill or ability. All expressions of opinion reflect the judgment of the presenter on the date of the show's publication and are subject to change. Annuity and life insurance guarantees are subject to the claims paying ability of the issuing insurance company. If you withdraw money from or surrender your contract within a certain time after investing, the insurance company may assess a surrender charge. Withdrawals may be subject to tax penalties and income taxes. Persons selling annuities and other insurance products receive compensation for these transactions. These commissions are separate and distinct from fees charged for advisory services. Insurance products also contain additional fees and expenses. All client or prospective client names have been changed to protect the identities of the individuals discussed. All rights reserved.